Hi, everybody. It's Patricia Coughlin. I thought I would talk to you today about how to begin psychotherapy sessions. Um, what I'm going to say is generally true. Okay, there are always going to be exceptions based on the particular case. But the way you begin a session, the way you conduct the treatment needs to be consistent. Your interventions need to be consistent with the theoretical foundation of your model. Now, since what I do in intensive short-term dynamic psychotherapy is in fact dynamic psychotherapy, that means that we are endeavoring to get to the bottom of patients' symptoms and suffering. What does that mean? It means get to the underlying cause. We don't just treat symptoms. We are there to discover and then resolve the unconscious conflicts that are responsible for the difficulties. Given that, we want to speak to the unconscious and listen to it, in contrast to engaging in a very cognitive, rational manner with the patient's conscious mind. So let's start with how we begin an initial session. According to Davenlow, who developed the central dynamic sequence, we start with an inquiry regarding the nature, history, and severity of the presenting problems. So we don't start with a general overview of the patient's life, but we ask right away, what are the difficulties that you're having that you want my help with? And you're going to press the person to be specific. What exactly is the problem? When did that start? We're going to try to identify triggers. So getting this data is extraordinarily important. We want to get an agreement about the nature of the problems to be addressed in the therapy. And as we do, we're then going to ask, so here's the problem, what's the goal? We also want that goal or goals to be clear. And then we're going to work together to agree upon therapeutic tasks, how we're going to get from the problem to the goal or the solution. This is extraordinarily important in creating and solidifying an alliance. And you need time to be able to do all this. So scheduling 2 to 3 hours for that initial session is absolutely crucial, especially if you're practicing ISTDP. It needs to be practiced the way it was designed. And by giving yourself time to get through the entire central dynamic sequence, from inquiry to specific triggering events, putting the patient on the triangles, doing, in most cases, quite a bit of defense work, so the patient can see that the ways they've been defending against and avoiding their anxiety-provoking feelings has actually been creating and perpetuating their problem, right? So if they can see that, they're going to be motivated to turn against it, to actually face and experience the feelings they've been avoiding. And as they do that, regarding either current people in their life or you in the transference, hopefully there's going to be some kind of unlocking of the unconscious with a link to the unresolved past. Again, you need time to be able to do this. And if you can do this in that first session, it's going to greatly intensify and accelerate the entire process. If you only give yourself 50 or 90 minutes for that initial session, you're not in all likelihood going to get there, and it's going to protract the entire process. And often it's going to become frustrating for you and for the patient because you keep sort of starting over again. So you want to have a very clear beginning where you get that agreement about the problem, the goal, and the task, and hopefully you're going to get some really clear idea of what the source of the patient's suffering is. So once you do that in that initial session, you've agreed what you're there to do. So it makes no sense to keep asking the person that in subsequent sessions. So first of all, I often see that therapists are not doing an adequate job of specific inquiries. So they're 3-6 months into the treatment and they still don't know what the precipitating incident was. They're just dealing with things kind of in general, and that's not going to be nearly effective enough. So you want to make sure you're getting that very specific information, and particularly you know what the triggering or precipitating incident was, and the nature of the conflict responsible for the person seeking help. Then once you get that, again, in dynamic psychotherapy, right, we are first of all expecting the patient to work, right? And we are going to be assessing in each and every session where the patient comes in on both triangles. Are they coming in with feelings very close to the surface regarding a spouse or a child or a boss, someone in the current? Or do they come in sort of shut down, withdrawn, with defense in the transference, for example? So you want to be able to assess that each time the person comes in, so that you're going to develop a strategy for how, again, you're going to get to the bottom of things, how you're going to get to the warded off feelings, right, either toward you or someone in the current, right, that's related to unresolved feelings in the past. So very often I see therapists beginning the session. So they're taking responsibility, right? So in dynamic psychotherapy, we don't start the session after that first session, okay? We're going to wait to see what the patient brings. When you start the session and you ask, what do you want to talk about today? Right, first of all, you're engaging the conscious mind, right? And you're kind of staying on the surface. You're also, in a sense, starting over, as if you didn't already have a session or 10 sessions or 20 sessions before that, right? So you have to remember where you are in the process and what the context of this particular session is. So I would really urge you not to start 2nd, 5th, 10th, 20th sessions, right? Once you've agreed in that trial therapy what you're there to do, then just do it. And so if the patient comes in and they say, I don't know what to talk about, right? They're in some sort of defense and resistance, and that's what you want to take up, okay? So again, make sure that your interventions are consistent, right, with your theoretical model, and that you're not in some way intervening in a way that is actually going to interfere with that, right? We want to be engaged in a dynamic process, and again, you're assessing in every session where the patient comes in, you know where you want to go, and then you're going to have your strategy for how to get there. So I hope this is helpful to you, and I look forward to hearing from you. Bye-bye.